I visit the dentist regularly for a dentist cleaning every year, but each time I feel a gap between my teeth afterwards. Is it common to experience this after a cleaning? Could it be a side effect of the procedure?
Um, I'm not sure like the gap that you are referring to, and particularly this is it's not an uncommon thing to happen. And so patient, and as you guys know, I treat gum disease all day long, and I've been doing this for the last like about almost 20 plus years, or 3 decades, I should say, for the treating gum disease. So what happens is when you have gum disease and your gums are all kind of swollen, right? Imagine, if you had like a big boo-boo and your skin is all swollen. When the swelling goes away, then you're going to become really flat, right? Or like if you have like a really gaping wound and you kind of did something to the skin and you got like it is really bad here, then you're going to even have a dent in the skin or the bone here, right? The same way, when you have gum disease, particularly advanced, moderate to severe gum disease, your gum tissue is going to be all swollen and it is red, puffy, bleeding, and you got like a lot of tartar under the gum line, and then your dentist has to give you numbing and go under all the way to remove all the tartar and the plaque and the bacteria and the inflamed gum tissue and the infected gum tissue and all of that. So now when that all happens, it's just like your skin when it heals, and it is just going to look fresh, but it's going to shrink the same way. Your gum tissue is going to shrink. And because you already lost the bone under the gum tissue where the infected gum tissue is, now your gum tissue is going to shrink. So guess what? Now you're going to feel like, oh, your dentist created the gaps in between the teeth, right? It's not we created the gap. It is because you lost the bone, and you would be continuing to lose the bone had you not come to see us, and we stopped it. But unfortunately, you got a little bit of a gap. But guess what? Like sometimes when patients have advanced gum disease and they already have a bit of a gap, and now I'm going to tell them, hey, you may feel like I'm going to increase the gap in between your teeth. It's not because I want to, but there is no other way. That's unfortunately the beauty of the beast and the way to treat the gum disease and to train the dragon, right? So we are going to create the gap even bigger, but in a good way that we want to help you keep your teeth. So you should be happy that you probably have some gaps in between the teeth, but as dentists, we did it for a reason.
And keep going.
Keep going, right? Don't quit. Yeah, don't quit going, and you need to continue going, particularly what you're talking about is the periodontal disease or the gum disease. You should be really seeing your dentist or the periodontist every 3 months to keep your teeth for the rest of your life.